Welcome back to Longevity Now FL. This is Luigi Fontana, the Scientific Director of the Charles Perkins Center RPA Clinic. Today we're going to talk about plant-based diets and the risk of developing bone fractures and bone health. Okay? So plant-based diets characterized by increased consumption of plant foods and reduced or no intake of animal products have sparked concerns regarding their potential negative impact on bone health due to the potential deficiency of vegetarian diets. A recent systematic review revealed that vegetarians, particularly vegans, defined as individuals who abstain from all animal-derived foods, exhibited a higher risk of fractures, of bone fractures, and lower bone mineral density compared to omnivores. Similarly, a previous study conducted within the EPIC Oxford cohort reported that fish eaters and vegetarians had an elevated risk of hip fractures in comparison to meat eaters. However, neither of these studies evaluated the quality of the plant-based diets, which, as I already have explained in a review article that we published in the prestigious European Heart Journal, is crucial. Not all plant-based diets are created equal in terms of healthiness. Well, the result of this new cohort study from the Harvard group of Walter Willett Franku, comprising more than 70,000 postmenopausal women from the US Nurse Health Study with a follow-up of 30 years. Yes, a follow-up of 30 years suggests that long-term adherence to a plant-based diet is not associated with hip fracture risk, is not associated with hip fracture risk. But most importantly, this study shows, or better suggests, because again it's an epidemiological study, that women consuming a healthy plant-based diet had a 21% lower risk of bone fracture, whereas those eating unhealthy plant-based diets experience a 28% higher risk of fracture. In addition, higher baseline scores in the unhealthy plant-based diet were associated with higher risk of hip fracture. As usual, these findings, as I said, are based on epidemiological data and do not establish a cause and effect relationship. A well-designed randomized clinical trial is necessary to evaluate the potential benefits of a healthy plant-based diet. In the meantime, vegetarians should pay close attention to the quality and composition of their diets. Data from epidemiological studies suggest that men and women consuming plant-based diets rich in healthier plant foods, fresh vegetable, legumes, minimally processed whole grains, fruits, nuts, monounsaturated rich vegetable oils, tea and coffee have lower risks of coronary heart disease and overall mortality, with regular fish intake providing additional health benefits. These studies suggest that these people who are consuming healthy vegetarian diets, plant-based diets with fish have also a bone protective effect. In contrast, people eating unhealthy plant-based diet that emphasize refined grains, potatoes, high sodium preserved vegetables, fried goods, sweets, juices, and sweetened beverages experience higher risk of diabetes, coronary heart disease, and mortality, and now also bone fracture. Plant-based food products marketed as vegetarian and or vegan can be rich in refined starch, added sugar, high fructose corn syrup, salt, partially hydrogenated trans fat, and saturated fatty acids from tropical oils. Remember that 1 tablespoon of coconut oil contains 12 grams of the proatherogenic saturated fat. Consumption of ultra-processed foods is also rich in sucrose and high fructose corn syrup, even if labeled as vegetarian or vegan. And they promote the development of insulin resistance, cardiometabolic syndrome, fatty liver disease, cardiovascular disease, and cancer and inflammation. And high salt intake not only increases the risk of developing hypertension, coronary disease, and stroke, but it also triggers inflammation by increasing monocyte CCR2 expression, which may play a role in osteoporosis. So just to summarize, eating a healthy plant-based diet rich in whole grains, beans, a wide range of vegetables, some fruits, fish, nuts, and seeds. It's healthy and is protecting your bones from fracture. In contrast, eating pro-inflammatory diets that can be vegetarians, but unhealthy vegetarians, and omnivore, high meat and high salt, high refined processed food, especially when there is no exercise, especially resistant exercise, very powerful for bone strengthening, is causing the epidemic of osteoporosis and increased risk of fractures, especially in postmenopausal women. This is everything for today. As always, this is Longevity Now FL. I'm Luigi Fontana, the Scientific Director of the Charles Perkins Center RPA Clinic and of the Health for Life program. I'm a professor of medicine and a clinical academic in the Department of Endocrinology of the Royal Prince Alfred Hospital in Sydney.